Okay, so this is just an explanation of how I medicate cats when they need eye medications, which is very challenging, so don't feel bad if you're having problems. Um, the first thing is kind of preparation, so I've really jumped the gun here because I should not have my cat out until I'm prepared. But I'll take the eye medication, and as long as it's not a medication that has to be refrigerated, then it's something that you can warm up to body temperature. So about 30 minutes before I'm going to give the medication, I'll take the eye medication and put it in my back pocket. That's a great place to warm it up. And then once it's warm, it's going to be less irritating when you put it in the eye. They'll feel it less. So then once it's warmed up, I will actually get the medication and bring it to the location where I'm going to give the medication. I will put it out on the table and remove the cap first so that you don't have to do it once you have the cat in your hands. So remove the cap, don't touch the applicator because we don't want to get any bacterial growth on the applicator, and just tuck it down next to where your dominant hand would be. I'm left-handed, so I'm actually going to put it on my left-hand side, but if you're right-handed, you want to put it on your right-hand side. So then you get your kitty, and hopefully they're pretty tractable. But I always put them on a countertop that is comfortable for me, because first of all, we want to make everything kind of that we can get to go in our way to help us out settled. So if the cat is up high, it's easier for you. You don't have to bend over as far. It also kind of scares the cat just a little bit, not in a negative way, but it's not a place where they would normally be. And so it's unsettling enough so that they're not as likely to, push you away and that sort of thing. So I put them up at counter height, and then what I do is I hold their little head, and from behind I'll lift the eyelid. And you don't actually have to put the eye drop in the colored part of the eye. You can put the eye drop in the white part of the eye. So I'll lift the eyelid with one hand, then I'll grab my medication with the other hand, and then just go ahead and pull that eyelid back and drop the medication on the white part of the eye and allow it to close. Okay, and then switch over to the other side if you're doing both eyes. This is not as fun because you're using your non-dominant hand, but just pull the eyelid back and drop it on the white part of the eye. And that's less frightening for the cat because they don't see you coming toward them, and they don't actually see the applicator until the eye drop is already in the eye. Then you can release your kitty. Sometimes a little snack right afterward will help them learn to hate it a little bit less. And then clean up your medication and hopefully you're all set. With cats that are problematic as far as giving them medication, I will sometimes wrap them. So kind of put them again on a countertop height and then just tuck a little blankie around them. And make sure that you're trapping their front legs a little bit with the blanket so that they can't reach out and smack you with their hands or grab you with their fingers and tear up your skin. And then the approach is the same. In a really difficult to medicate cat, I might get down a little bit and use my chest as pressure to hold the cat to prevent them from backing up. But again, not a lot of pressure. I'm not trying to squash the cat, just trying to give it a very tight little space so that it can't move out of the area that I need it to be in to apply the drops. So hopefully that's helpful to you, and feel free to give me a call if you're having any other problems, and maybe I can help you work through them. So thanks.